Hi, everybody. My name is Robin Campbell. I'm a PhD candidate at Dalhousie University through the School of Occupational Therapy, and Crystal Dealman is my PhD supervisor. So she's asked me to do a presentation today for you on attending to or how volunteer firefighters attend to their mental health. So I'm just going to pull up the PowerPoint that I created for the presentation today, just to help me along the way. So this is the area that I've focused on for my PhD in my area of study. I also myself was a volunteer firefighter for about 10 years in rural Nova Scotia. So what I'm just going to do, this is going to be a pretty quick presentation on quite an extensive topic, but I'm going to see how well I can do in the 15-20 minutes that Crystal asked me to speak on this. So I just want to give you a brief background on volunteer firefighters in Canada, a bit about the two studies from which a lot of this information that I'm going to talk to you about came from, a little bit about volunteer firefighter stress, and then how volunteer firefighters are attending to their mental health needs, and specifically looking outside sort of the formal mental health system. So again, so the purpose of this is to really kind of discuss and hopefully help you learn a little bit more about volunteer firefighters and how they attend to their mental health needs outside the formal health system. And I'm specifically going to be talking about volunteer firefighters versus other types of firefighters. So there are various different types of firefighters, so paid, or sometimes you hear it called career firefighters, wildland firefighters, national defense firefighters. So I'm talking about volunteer firefighters in general in Canada, and my studies have focused on Nova Scotia. So that's what a lot of this information that I'm going to talk to you is about. So a little bit more about volunteer firefighters. So in Canada, volunteer firefighters actually make up close to 83% of the fire service. So even though a lot of times we think of the big city paid firefighters or career firefighters called, volunteer firefighters don't like it when they're they also feel that they themselves are career firefighters or professional firefighters. So I always say paid or volunteer to try to distinguish. But volunteer firefighters make up 83% of the fire service in Canada and closer to 90% of the fire service in Nova Scotia. So the majority of firefighters are actually volunteers. They volunteer their time to do this. This isn't their job. This isn't their livelihood. This isn't how they make their day-to-day pay. This is something that they do in their leisure time. So the third point there is this is seen as a serious leisure occupation because it's so similar to a career or a paid sort of job with the training and the time commitment and everything. So volunteer firefighters generally are actually on call 24/7, 365 days a year to respond to fire calls. Most of them carry a pager. Some have advanced their technology, so they get paged out through their cell phones. They get a text saying there's a fire call. You need to respond to the fire call. So it's a very different volunteer gig, I guess, than a lot of others. They're also putting their lives on the line every day. Every time they respond to that call. So a lot of volunteer firefighters, as you can see, 24/7, your pager at any point, you have no idea when a fire call is going to come in. A pager or your cell phone goes off saying it's time to respond to the fire hall for a call. And these people leave school, leave work, leave their families, what have you, to respond to these incidents. So that's a very different thing from a paid job where somebody is at a fire hall for a 12-hour shift and they just do what they need to do in that 12-hour shift and then go home and don't have to think about work until the next day. So that's why this is categorized as a serious leisure occupation. So it very much takes up the social life of these people, but really is quite a balancing act of all the other aspects and occupations that take up their lives around family and their, whatever they do for an income. So very, very different. Most volunteer firefighters and volunteer fire departments are located in rural communities across Canada, but for those of you that really understand Canada, most of our communities are rural communities. So that's where we tend to find a lot of volunteers and fully volunteer fire departments. There's no paid employees generally at these departments, completely run by volunteers. You do see volunteer firefighters sometimes within city fire departments as well, but that's depends on the city. Halifax, for instance, does have volunteer firefighters in most of their fire departments. Not all of them, but a lot of them, especially the more rural communities of Halifax Regional Municipality. Also important, which is kind of a myth, and I think the word volunteer can have this happen, is volunteer firefighters have the equivalent training to paid firefighters. There's no difference. There are standards set and they have to meet them. And they also respond to the same types of calls as paid firefighters. So they respond to car accidents and medicals and structure fires and rescues and everything the same as paid do. So there's this myth or misunderstanding that volunteer firefighters don't respond to the same amount of calls or same types of incidences, but they do. And sometimes more because they're rural, so they have to make up for that. So sometimes in rural communities where there maybe isn't a paramedic base or ambulance nearby, they also have to make up for the medical side of things where it might be 20 minutes before an ambulance gets there. So sometimes volunteer firefighters do actually even more than the paid firefighters. But then on top of that, because they're volunteers, another difference is that a lot of the time is spent fundraising to get to have the equipment that they have. So there are taxes for fire service in rural communities, but they're very low and they don't necessarily pay for the fire service. So that's why you'll see a lot of fire departments doing bingos in rural communities, doing bingos or boot drives or 50-50 draws or different things. It's because they need to fundraise for their equipment. So it's a very interesting emergency service that is an essential service, but these are volunteers and they have to fundraise for what they have. Whereas you don't see that with other emergency services. So that's my quick background for you on volunteer firefighters, even though I could talk about this for days. So then I just wanted to mention the two studies that I'm sort of using a lot of this information from that I'm going to tell you about. So I've done two studies. The first was after the alarm research study. So both studies were with Nova Scotia volunteer firefighters. So this one was really looking at how volunteer firefighters cope after potentially traumatic incidences and what places and spaces are meaningful for them. So this was really looking at where do they go in their communities? Where do they seek support or help in that? So that's one study. And then the other study, this is for my PhD, for my dissertation, and this is called Sound the Siren. So this was really looking at how the occupational environment impacts mental health and related services and supports for volunteer firefighters. So this one was looking at community, and this was a survey, and just looking at how do you really cope and what part of your community helps you or doesn't help you cope. And this one was really a much more in-depth looking at the occupational environment. So the fire department, the fire service, the community, workplace, like all the different aspects of somebody's life and how that impacts mental health and well-being. And this one I actually was more interviews, focus groups, and actually a photo elicitation piece to it. So just to give you a little bit of where this information is coming from. So before I can talk about how firefighters cope with what they deal with, I have to kind of talk about what they deal with. So firefighter stress, and in public safety or this area of research, we talk about occupational stress. And so there are two types of occupational stress. There's operational stress and organizational stress. And then I added a separate outsider stress based on my studies and the information I've collected. But it's a lot of times we think of firefighter stress as the operational stress. So we just think about you're responding to traumatic incidents, so fatalities or seeing death, seeing gruesome things, and how that would affect you. And so a lot of talk has been recent about PTSD and suicide among firefighters because of what they see and what they experience, and that is very much at the forefront of firefighter stress is what happens on the fire ground when you respond to those fire calls. But the other side of the stress that isn't researched enough, and where I really took my research, was looking at the organizational stress. And what I found is that can really impact the mental health and well-being of volunteer firefighters almost as much as the operational stress, or it can add to the operational stress. I've responded to these calls, but then I have all this other kind of crap to deal with as from an organizational standpoint. So when I say organizational, talking about, your co-firefighters, your peers, so kind of that group dynamic, leadership. So in firefighting is a paramilitary organization. So there's a ranking structure. You have fire chiefs, deputy chiefs, captains, and so they give orders. So there is a leadership hierarchy system in the fire service. Constraints around funding, even different things like that. And as you can see from the cartoon, it kind of starts to give you a little idea, a little sense of the general way of firefighting is, I don't need help. I'm okay. I can deal with it. I'll deal with it. But then you see all these sharks around of marital stress or different things, right? So marital stress, that's one of the kind of the outsider stresses. So everybody's also dealing with things in their own life as well. So then the outsider stress, the other thing that I found from my research that also adds to the stress of firefighters is public perception. So a lot feel misunderstood, or that there's this very odd way in which public perceives firefighters. Generally, it's a very welcome thing, but it's like that they're the heroes, or they have to live up to this standard to the public, and it can be quite stressful to keep that, especially when this isn't your day job. This is your leisure time, right? And then social media. So I've started to learn that social media can be quite an outside stress of one, dealing with comments about, so, let's say there's a picture up of the recent structure fire that people are sharing on Facebook. Well, why did they do that? Why did it take so long to respond? Why, all those kind of comments, the critical comments, but also the re-traumatization from seeing that. So if that was a really traumatic call for you and really is getting to you, you go home and you're trying to get away from it, and you go on your Facebook or Instagram, and there are images right there, and it kind of re-traumatizes you. So there's a lot that's going on for stress. And I guess what I want to emphasize is it's not necessarily just about responding to the call. There's all these other dynamics and all these other things that are happening. And that's really important to know. So that way we kind of understand a bit more about how volunteer firefighters attend to their mental health needs and what we can do as health professionals to support them. So this really came from the After the Alarm study. So that first one where I looked at community. So I wanted to kind of speak to what I found in that. So one of the questions I asked was, what places or locations do you go that helps deal with potentially traumatic or stressful incidents? And so there was really just kind of three things. A lot just go home, but, deal deal with things at home. Not necessarily speaking to their family about it. That tends to not be, they don't want to burden their family with information, and that's quite standard across all public safety agencies like police, paramedics, military, fire. Sometimes we like to lump them all as one, even though they're very different um, occupations. So a lot find that home is a place where they can just get away. Also the fire hall. So there's this feeling of peer support. The only place I'm understood is the fire hall, the fire department. So a lot of volunteer firefighters too, which is different from if this was your job. During their spare time, they hang out at the fire hall. They hang out there. That's where their friends are. Their fellow firefighters are their friends. They know what they've gone through. They've been there. They can chat about things. Do they sit there and talk about their feelings? Not necessarily. We'll talk about the different ways in which they do the peer support or talk about what's going on. But the fire hall is definitely a place of gathering and community and feeling of safety almost for firefighters. But then you can imagine on the flip side of that, and this is what I started finding out with the sound of sirens study, is what happens when it's not as safe. You're not getting along with your fellow firefighters. You're mad at each other. Leadership is, things are falling apart. So it's both sides of it, right? Same with home, both sides of it. It can be a sanctuary, a place to get away, but it can also be a place if, perhaps your marriage is falling apart, and added stress. So then what happens? You go to the fire hall and you hang out there because you don't want to be at home. And then the other thing was recreation. A lot of what I'll call green spaces or blue spaces seem to be very healing for firefighters. So going for walks, going in the woods, some, hunting or fishing, going to the beach, being by the water, if they have that option. So just getting outside seemed to be a trend for firefighters. The other question I asked was if there's any places that they avoid. So I was really interested to see what came out. And that was crowded places. They tend to not like to be in crowded places where they have to be around a lot of people. Because there's this sense of just not understanding. The other thing about rural communities is everybody knows everybody. So you might run into people and they're asking you about, oh, I heard about that last fire call. Sounded like a bad one. Or you might see people that were part of it. That was their house that burned down or their family member that was in the car accident. So that tends to be something they try to avoid a lot, especially if they're having a hard time dealing with what they've been through. And accident scenes. So a lot of firefighters talked about the fact that if they were at a certain, in their community, this accident was on this street and they have to go by that street to go to work every day, they'll actually avoid it and go a different route because they just don't want to see it. It's too much of a reminder. So we'll get into a little bit about that concept as well. And that's kind of around firefighters, a coping mechanism is to not think about it. I don't want to think about it. I just don't want to deal with it. So I'm going to avoid looking at pictures of it. I'm going to avoid driving by the scene. I'm going to avoid it at all costs. So then another question I asked was, what resources are you aware of your community to help with stressful incidents? So this was trying to see what formalized systems exist. And honestly, the biggest answer was nothing. A lot felt that there was nothing to help them. No systems, no services. The only things they felt were like home, fire hall, and outdoor recreational areas. If they did mention a resource, some might have talked about like EAP or EFAP, so like employee assistance programs. A lot of people that talked about this, they actually don't have access to that through their fire service. They might have access through their employment. So that's another factor of being a volunteer, is that you do not have the same resources available to you as if this was your paid job. And firefighters come from all different walks of life. So there's no guarantee that where they work would have these kind of resources. There's no guarantee they work in, a very structured institution or organization like a health authority or a government agency that would be like, yes, we have EAP, and yes, we have this available to you. You have sick time and sick leave and all these things. Many are construction workers, farmers, so many different jobs where these things aren't available. So kind of hit or miss. Maybe you have access, maybe you don't. Some fire departments do, some fire departments don't. It just depends. They're all different. They're all their own agency, their own organization. So they're all run differently. There's no standard for it. And then the other thing that is, especially in Nova Scotia at least, consistent is called the critical CISM, so the Critical Incident Stress Management Team. So there is a team through the Fire Service Association of Nova Scotia that is available to all the volunteer firefighters to access. This is very much a reactive program. So you might have heard of critical incident stress debriefings. So if there's something that's happened, the fire department will call, the team can come in and do a debriefing and do some follow-up with members who might be struggling. But again, there's some complications to that. That's only available if when the fire department knows it exists, leadership has buy-in to it. So there's also that. Not everybody thinks that mental health is an issue and that it needs to be dealt with. Some are still the old school mentality of suck it up, buttercup, and let's move on. It is changing. It is getting much better. But there are still, that mentality still exists. So the reason I'm saying that is in order for most departments to have this group come in, it's actually the senior officers who make that decision. So if they don't see a need for it, we don't need that. So, and also, do they even know about it? So there's two sides to that. And again, that's very much on their other end, the reactive end. It's not preventative. It really is about let's deal with what's happened. So those are a few things from that study that firefighters spoke about to try to help you understand where firefighters are coming from. So then from my other study, the Sound the Siren, this is just some preliminary things that have come up. I'm still in the analysis phase of this, but really about attending to mental health is really talking about, they call it the fire family. Some of you might have heard before of something called like the brotherhood or the sisterhood of the fire service. Police also use that sort of terminology, but really they think of each other as family versus just colleagues. So they lean on each other. So that comes back to that kind of peer support. That's where they really start actually with attending to mental health. If they're ready to do that, if they're in a place, I'll talk about some of the more negative things, but really that seems to be the first place they go to. We lean on each other. We turn to each other when we need each other. And then also the critical incident stress management team. So those seem to be really the most common things that volunteer firefighters, where they look for support. Or like from the after alarm study, nothing. They just feel like there's nothing, there's nowhere they can turn. So what that leads to is isolation, right? Feeling isolated, feeling excluded, especially if your other fellow firefighters don't seem to be struggling or experiencing the same thing. You might think, I'm different, or maybe like, what's wrong with me? So there's a lot of things that happen that way. And even this cartoon is like, those traumatic calls never get to you, do they? You're a rock buddy. So that you can see this person is internalizing it and not letting it out. So even though these fire family peer support, these things exist, a lot of firefighters do internalize and don't deal with it. and let it sort of bottle up, and all aspects of it, all aspects of the occupational stress. And so the other thing that started to come out of the Sound the Siren study, besides the isolation piece, was, I kind of alluded to this, was to not think about it, avoidance essentially. And that was really strong in this, is if I don't have to think about it, I don't need to worry about it. It's just this compartmentalize. I'm going to put it over here and forget that it happened. But over time, that's not going to be effective. Another way is, I've had some talk about alcohol. I go home and I just need a drink, or do other substances. So that is also common. And then the other thing that tends to happen a lot is to try to depersonalize. So avoidance of humanizing what's happening. So one firefighter talked about, I don't look at faces. I don't want to see faces. I try to just take the human element out of it so I can deal with what's happening. So it's another avoidance strategy, essentially. So that's sort of what's happening there. So to keep going with more coping strategies, is these really seem to be the most common types of strategies. So one of the things I was talking about with, talking about peers of the fire department, your fellows, because they really understand what you've been through. There's no fear of, I can't say this or that, or they won't get it, or any of that. The fellow firefighters get it, but they don't go in and say, I'm feeling, this is how I'm feeling, or anything like that. There's this dark humor or these other ways of how they talk about it, right? Now, sometimes, obviously, if there is, if somebody's in a place and feeling good enough and they have the right person that they can actually truly talk to about, not doing so well, those things. But sometimes we think of peer support as this very sort of like, oh, we're going to sit and talk about our feelings and talk about what's happened and all those things. But really in the fire service, it's more about, let's joke, let's do some dark humor, let's laugh about it. A lot of storytelling. That's how they talk about it. So it's a different sort of language that is used. A lot would not be able to relate it back to, I'm feeling like this. And again, this is generalization. Obviously, not every firefighter is like that. Exercise in nature, being outside, seems to be certainly a coping mechanism, a way to attend to mental health needs. Time with family and friends. So a lot spoke to needing that time just to kind of get away as well. So another avoidance thing. Depersonalize, I talked about that. That's the dark humor has really, or just the joking, has really come out. And that is how firefighters and other first responders tend to express how they're feeling about something. So to the outside world, it would seem probably inappropriate, maybe not okay what they're saying, but inside, going back to everybody gets me, we understand each other, it's not necessarily seen that way. It's normalized. So just to give you a little bit more about the resources. So I said it was intended to, so those things are what happens outside the formalized health system. But I wanted to allude to also some of the information I had about why it's hard for volunteer firefighters to access the formalized mental health system. So I talked about funding and employment and things. So ability to access resources through their employment tends to be the only way, right? Do I have coverage? Do I have these programs available through my actual employment? Because in the fire service, I don't have it. And majority, there is the stigma. A lot find that clinicians just don't get it. They don't understand me, because you can imagine I'm coming in, I'm used to talking about these things through a dark humor or, maybe inappropriate language. And they feel that clinicians don't get it. They also feel that most of their time, the ones that have talked about the fact that they have seeked out a professional before, that most of the time is spent trying to explain what they do versus really getting to what's happening with them. And again, generally the only formalized system that a lot use are the critical incident stress debriefings. That's what a lot talked about. But most of the time, they either do not know if there are services available, they do not know how to access them, or it actually is not available. And so one of the questions I had was in the survey, the after the alarm study was, what places or resources do you wish you had? So, you know, what do they wish they sort of had if they could have that? A free mental health services where clinicians understand firefighters. That was really, really important. Where I don't need to take the time to explain what I do. You already get it. Big wish, but important, right? More accessible and affordable. So like I said, most of them, the only way they have access to this is through their actual employer, not through the fire service. They would like to have access to these things through their fire service, to have some sort of program or funding available to them, like an EAP program, even though those that do tend to have it don't really access it. So not sure. I think they're just trying to stretch to say, just want something that's actually through the fire service, right? Something I don't need to go to my employer for, because that becomes complicated. More training around mental health and more public awareness of volunteer firefighters. The volunteer component was really something that was talked about a lot. And the training, they want more preventative and to learn more. It was really stood out. So just to end, because I imagine I talk a lot, so I'm probably over my time that Crystal asked me to do, but some of these just really stood out to me. These were from the after the alarm study, but just kind of giving you a little bit of a sense of where they're coming from. So the first one, it all comes down to finding something separate from the world that also makes you happy. Many firefighters get wrapped up in the world of firefighting and it consumes them. So as fantastic as the world of brotherhood, sisterhood is, you need to find a safe place outside of that to the world to heal your soul. So really talking about, you know, they need a place outside of the fire department that they can go, because that's where most heavily lean is their fire department or fire hall. And I say both because depending on the person, they call it something different. I would like to see more info about mental health issues just being presented to departments during regular time periods, not just after bad incidents. So this was really common. I don't want to just know about this after something happens. I want to have more preventative measures. Deal with a local place to deal with everyday stressors to keep us healthy. So something again outside of the fire department. And then here's the peer support side of it. Being together after hard calls is the most meaningful. They're the ones that understand the most. So coming back to that understanding, getting me is really important in tending to the mental health needs and to have that occur. So that's why peer support really goes a long way in the volunteer fire service and in the fire service in general. So that's a lot of information in a nutshell. Like I said, I could talk about this for a really long time, but obviously I don't have that time. So Sound the Siren is my PhD work. I have a website and social media. So if you want to follow more, if you're interested in learning more about firefighting, firefighter health, and you'll have seen Firewell through my presentation. This is the research network I'm part of, where we do all firefighter health research across Canada. So a lot of information comes out of that as well. So I hope you learned something. Crystal also has my email. So if you are interested or want to know more and want to reach out to me, I'd be happy to discuss any of this information further. All right, thank you.